Morning, Ms. Davidson. My name is Carmine. I'm the student pharmacist here working with your team. Do you mind if I speak to you about your medications and your medical history right now?
I'm stuck here.
So I'm sorry you feel stuck here. Hopefully we can get you out of here pretty quickly. Just to make sure I'm speaking with the correct patient, can you verify your name and date of birth, please?
Samantha Ann Davidson, 12/28/1994.
Okay, great. Thank you, Ms. Davidson. So can you tell me what brought you to our unit?
I was in a bad mood and I said something stupid and my boyfriend got all upset and now I'm here.
Okay. So I completely understand you don't want to be here. Would you mind if I asked you some more questions so we can come up with a plan together and work towards getting you discharged?
Yeah, I want to be better so I can go home.
Hey, I don't blame you. So you mind if I have a seat?
That's good.
Thank you. Okay. So finding out the symptoms you're experiencing is kind of the first step in treatment. I'm going to ask you some questions about how you've been feeling in the past few weeks. If you can let me know how many days you have felt this way, basically like every day, most days, only a few days, or not at all. It's okay if you don't remember. Is that all right?
Yeah.
Okay. So, over the past 2 weeks, how often have you had little interest or pleasure in doing things?
I don't want to do anything. Nothing's fun.
Okay. So, over the past 2 weeks, how often have you felt down, depressed, or hopeless?
I guess all the time. Like, just everything's too much right now.
Okay. So, how often in the past 2 weeks have you felt that way?
All the time.
All the time. Okay. Well, thank you for sharing that with me.
Just like the past 3 or 4 days have been really bad. I'm not doing really good in school, and I feel like I'm just letting everybody down. I just don't exist, you know?
Okay. So, you mentioned feeling bad about yourself, or that you let yourself or your family down. How often have you felt this way in the past 2 weeks?
Every day.
Every day. Okay. Just a few more questions. So have you noticed any changes in how much you're sleeping? More or less waking up all the time when you do try to sleep?
Um, I wake up and I just stay in bed all day. I go to school, but then I just come back.
Okay. So do you feel tired or have less energy than usual then?
Yeah, I don't even want to move, but there have been some good days.
Okay. What about your appetite? Have you had a poor appetite, or do you tend to overeat sometimes?
I don't want to eat, but my boyfriend makes me eat. He's trying so hard to make me happy, and I'm just not. I just hate feeling like a disappointment. Are you done yet?
So just a couple more minutes. I definitely hear your frustration, and I see how you're feeling. These questions will really help the team to kind of guide the treatment for you. So can we continue just for maybe 5 more minutes?
Yeah.
Okay. So you mentioned trouble with your schoolwork. How often are you having trouble concentrating on things, such as reading the newspaper or just watching television?
Some. Not really, though.
Okay.
Maybe like twice.
Twice, okay. Have you noticed yourself moving or speaking more slowly, or the opposite, so fidgety or restless, that you've been moving a lot more than usual?
No.
Okay. Have you had thoughts that you would be better off dead or hurting yourself in some way?
Yeah, that's what got me in here. I said I'd rather be dead.
Okay. And in general, the things we've just talked about, how difficult have those problems made it for you to do your work, or take care of things at home, or even just to get along with other people?
I just kind of avoid everybody. But they're still mad at me. I can't get anything for school done. So really hard.
Okay. So that's it for the questions about your mood or how you've been feeling. Now may I ask you some questions about your medical history?
Again, they already asked me downstairs.
If you don't mind, I'll just ask again. Pharmacists sometimes have a different way of doing things and looking at things. Is that all right?
That's fine.
Okay. So, do you have any allergies?
Seasonal.
Seasonal allergies? Okay. What about any allergies to food or medication?
Pineapple.
Pineapple. Oh, I love pineapple.
I used to.
Well, I mean, pineapple's not that great anyways. You're really not missing anything. What about smoke? Do you smoke?
No.
No? Okay, that's good. Do you do any type of illicit drugs?
Like heroin?
Yeah, anything like that.
No.
Okay. What about marijuana?
Sometimes.
Sometimes? Okay. And are you taking any other medication?
I take Claritin for my allergies.
Claritin for allergies. Okay. Thank you. So have you ever felt down or depressed like this before?
Yeah, I was 17. I told my primary doctor, and I was crying and not eating, and she gave me like Prozac or something. I only took it for a few months because I didn't need it. I was better.
Okay. By chance, do you happen to remember the strength of the Prozac you were taking?
No, she gave me something low because I'm not like crazy, and then
Right, yeah.
she said it wasn't working, so I had to take 2 of them.
Okay, so take 2 of them. All right. Have you ever tried to hurt yourself or commit suicide?
No, I keep telling people I don't really want to die. I just don't want to be alive. It's like pointless. No, I'm fine now though.
So if you do happen to feel that way again, please let us know. We want to help you. Does anyone in your family have any mental health problems? Mom, dad, siblings?
I think my mom has depression. She sees a therapist and takes medication for something. My sister has anxiety.
Okay.
I just have like allergies.
Okay. Thank you, Ms. Davidson. I know I asked a lot of personal questions. I really appreciate you answering them all. Do you have any questions for me?
Can I just take Prozac again so I can go home? I just want to be normal.
So I'll definitely let the team know you've taken Prozac in the past and it worked well for you. What else can I answer for you?
That's it, I guess.
All right. So I'll be around on your unit. If you think of anything else, feel free to ask for me. Again, my name's Carmine. I'm the student pharmacist.
Thanks.
Hope you feel better.